We are incredibly excited about the opportunity at the National Symposium to demonstrate our strategic partnership with companies like ParaHealth and the Rothman Index and Strata Decision Technologies, along with our partnership with our internal collaborators.
The equation that physicians have always used is that the higher the cost, the more we spend, the better the quality, the better the outcomes for the patient. So an opportunity to sort of rethink that, to ask another question, whether that question being if we actually reduce costs, can we increase quality? If we actually narrow our focus in terms of patient care in a way that actually defines the care continuum in a very different way, that actually asks the question of how can we actually improve the overall care and the quality, but also reduce costs, different way to look at it. And using analytics to actually assess that and to evaluate that, that was a different conversation.
When you can intervene and keep a patient free from harm, you're not only promoting quality, but imagine the cost of that particular patient having to go to an intensive care unit, the pain and suffering for the family, to go back to the unit, and then extended that length of stay for that particular patient who went home the following morning is a pretty impressive story.
We have this tremendous academic system. We have 3 hospitals that are very, very different, but at the same time very similar in that the patient is the most important person in everything that we do. And one of the ways we want to do that is always pushing technology to achieve the next level.
With value-based purchasing and other pay-for-performance programs, how well you treat a patient across the continuum of care over an episode of care becomes really important.
Our challenge, I think, is thinking about ways together as a healthcare community about how to take all that data and turn it into important, useful information to drive the care of the patient. And that necessarily requires some way of thoughtfully and carefully organizing it in a way that can provide the important pieces of information to the important caregivers at the time they need it.
I think that data-driven metrics, like the Rothman score, really do help bring people together, because people can, and we routinely do this in our coronary care unit and on our step-down floor, where the team sort of comes together around a table and we look at the Rothman scores and we sort of make a plan with everybody at the table. And I think this is really one of those really critical tools that facilitates that kind of conversation, forges that kind of relationship, and deepens the kind of teamwork and spirit that this institution certainly is all about.
We decided that we weren't going to be the team that someone just calls. We wanted to go out and really proactively round. So that's where our proactive rounding concept really began.
I think it's a really important and critical question to understand, the perspective of nursing, the perspective of, say, the primary medical team, maybe the rapid evaluation team. How do you all come together and come to kind of a single standard for making a decision?
Being able to get all of us to be able to share what it is that we've done and potentially learn and educate others on our model is going to really be incredible. It'll allow us to, again, maybe help influence the lives of other patients and other organizations, and us to learn from the other organizations as well. So really excited to be able to host that here.